Thank you, Mr. Speaker. It's good to be back. An internal memo obtained by CBC indicates that new AHS Board Chair Stephen Lockwood has the full backing of the province to offload its responsibilities onto local hospitals without consultation or clear plan. This has left senior management scratching their heads and wondering who's in charge, the executive, the health minister, or the premier. To the premier, is your interference an admission that the government's AHS experiment has failed?
Well, Mr. Speaker, I was quite pleased today in my scrum before question period to be asked exactly this question by the Canadian Broadcasting Corporation. And I have to say, Mr. Speaker, I was pleased to hear the good news, because what we've heard from the opposition and what we've heard from Albertans is they want to make sure that health care is delivered in our communities. And the best way to do that, Mr. Speaker, is to keep local managers and health advisory councils involved. So I think it's fantastic that local communities are going to be directly involved in consulting and delivering on health care in their communities, Mr. Speaker.
Honourable Leader, Liberal Opposition.
Thank you, Mr. Speaker. The right thing done wrong could cause problems, given that the Health Quality Council recommended against further shuffling of AHS management deck chairs and recommended to focus on reducing hospital occupancy rates to 85% by improving home care and long-term care.
Yes.
Why is the Premier ignoring Dr. John Cowell's advice? Premier?
Honourable Premier.
Mr. Speaker, the interesting thing about running a health care system that's as large as the one that we have is that you can't do what the honourable member is suggesting and focus on one issue at a time, Mr. Speaker. We are at the moment making a commitment, and have through the Chair of Alberta Health Services, to work with local communities to do exactly what local communities have said, and that includes, Mr. Speaker, family care clinics and better support for long-term care. It's going to allow, Mr. Speaker, for greater operational flexibility, for lower costs, for opportunity for community engagement, and it will create an engaged and an innovative approach to health care for all Albertans, including long-term care, Mr. Speaker.
Mr. Speaker, there's a reason they call this question period and not answer period. Given that the AHS Performance Dashboard from June 2012, shows that the government is warehousing 467 seniors in hospitals and another 1,000 are still in limbo waiting placement.
That should be in long-term care.
Why is the Premier yet again renovating the management structure instead of renovating her government's failed home care and long-term care policy?
Indeed.
Honourable Premier.
Mr. Speaker, the exciting thing about health care is that you can have an integrated approach to resolving problems, Mr. Speaker. And I have to say this question does not suggest that the honourable member actually understands that, Mr. Speaker. We know that it's possible to develop innovative approaches to access to health care and long-term care, the work that our Minister of Health has done in conjunction with community leaders in support of decisions that are being made in Alberta Health Services, Mr. Speaker, to create better opportunities. And I thank him for that, Mr. Speaker.
Thank you.